ability to override these signals from the niacin, and I was able to relax into it.
From niacin?
I was in about 12 minutes.
From niacin?
Yeah, I had niacin, and then I got into an ice bath, and my body
How
just
much? How much niacin?
500 milligrams, so my whole body was red.
Really?
Oh yeah, my body goes all red.
Oh, you use 500?
This color, yeah.
Because I try and take less. I try and take
250.
I don't. Well, I don't know. I take. It depends. Well, I have them in the tablets. So
Yeah.
I'll halve it or quarter it until I barely get a flush.
Yeah.
Because sometimes I just feel like something's going wrong. If it's too, if you flush too much, it feels like.
If you exercise while you're getting the flush,
Sure.
it actually changes it quite considerably.
I found that if it moves as well, then it doesn't. Especially around my elbows and knees, it doesn't flare up. When it stays still, kind of right. It's no adverse effects to it.
If you start exercising specific areas of your body, say your legs and side, the niacin will move down to that area. And it will, because the oxygen is going through it a lot more, I think it will help the development of the muscles.
Very interesting.
I've never ever looked at that, but that's
No, but it makes sense, doesn't it? The cycling is true. Yeah.
because when I was walking, I found that instead of it happening up here, which is what tends to happen in part of the vascular area, if I start walking, it starts happening.
Sometimes you can take acid and then do something.
Yeah, you take an aspirin before exercise, because that moves everything around. And then after the exercise, this is what the guy in your got support. You get people to take niacin, exercise, so an hour before exercise, take niacin, 40 grams a day. You exercise while the niacin
I'm just finishing
so you exercise to create sweat, and then you go into a sauna as well. And you're taking lots of anti-inflammatory pills. So within 6 weeks, you cured anybody who's the only girl who just missed
I was also chairing a talk. I'm talking about taking Islamic very, very clever this chap in
That's really interesting.
like about
Multipliers, it makes a real big.
he started the field of medicine live. What he was saying is that get Romania, but I think they've got practice.
Are there more coming?
Or someone deciding
Do you suffer cold water? Yeah.
Okay last week, I mean, we're good, but, you know, it just, yeah, I mean, it's fine, but, you know, if you're moving around, then we got a compressor on it, so it sort of holds it there. And last week, I watched it, it was really good.
there's a place to stand, a place not to stand with that lighting.
No, because this is low light, it
from here. Sharif,
You're a bit taller than Sharif.
I worked that one out. So no, it's just the lighting. Because I think here you're sort of between lights,
Yes.
whereas here or even here. What, is it changing the level much?
There is better.
Yeah.
Yeah, you're absolutely
Forward
right.
is better.
In an ideal world, yes, we could have a little.
Can we
bit of
move
light
the?
there, yeah.
Can we move the podium forward so that he's going to be in a decent light area?
Yeah, actually.
As well.
Now normally he's speaking about here. Is that better?
It is, yeah.
Because he's always going to be about here.
Yeah.
Yeah, that's better.
And because Sharif is
That's my two visitors for the week done.
the way I was teaching was actually he said instead of white background,
We can bring
background.
You still can't bear the thought of it without sugar, can you?
Use green background. So we're
I've actually stopped having
yeah.
sugar in coffee, which I thought was impossible.
That could go along with making it up. We got lots of light.
No, I can drink tea without sugar, but coffee without sugar. Now I had to have a spoonful of honey in it. And over the last week, I know I drink less coffee. But it's, I've got used to it now.
It's a little bit
That's absolutely how I found it as well. It takes 2 weeks roughly. No, because if you stop taking sugar, you need to suddenly kick that within your coffee. I know. Sorry, I know that.
I had a biscuit tonight. I thought, that's
You can taste it, can't you?
Yeah, it
You
does.
really taste the difference. You do, you absolutely. You do, don't you?
So I would rather not have the tea than risk the sugar.
But also, I think if you have less bitter, because I don't like really strong coffee, but I can get used to it. Most places
I buy the lower strength coffee, like a grade 3 or a 2, and put a bit more of it in. And it's got that roundness to it.
but if you want to go for
I do it. And the Waitrose one, yeah. I reckon
Like some of the choice things that I
I think we should start.
Oh, okay, so it wasn't
Well, I want to welcome you all. Oh, hang on a second. Where is the... Oh. I'm so used to projecting my voice, you see. That sort of thespian in me comes out. I'd like to welcome you all and all of you watching us on the live streaming. It's always a great honor and privilege to get together and get healthy together. This is a very powerful community that we've built. Quite a lot of people are missing. I don't know why, but we do have these sort of gaps. Some of them are still downstairs. But not to worry. We carry on from strength to strength. And I'm always excited and I always anticipate to hear great things from Dr. Sharif because he really enlightens us and gives us information that we need to know. But it's information that we can digest. It's not so scientific and so medical that we don't understand it. So it's the ability to apply it in your life and know that it works. And I mean, all of us have great testimonies. The first group, we had these phenomenal testimonies, and we put it down to the fact that it was the right information because it's knowledge of the truth, not just the truth that sets you free. It's knowledge of the truth, but also the power of community, the power of encouraging each other, sharing, and that should never end. So it's always good to be able to do it with other people because it's quite a lonely place when you choose to change your lifestyle. I don't know about you, but it is because not everyone's going to buy into it. But eventually, well, if you stick with it, I found that if you stick with something, then those around you eventually go, you know what, I need to try this. And they jump on board as well. And then you have more people, to journey with. But we've got a great bunch of you here and a lot more. I know from about 5 countries are tuning in. And welcome to the people in Scotland. And sorry, last week we had it on private, but it's on public this time. So welcome to everyone. And I'd like to hand over to Dr. Sharif.
Thank you very much indeed, Pastor Chris. That's really very kind of you. And I would like to say thank you very much indeed for taking the time and the effort to come tonight. And I hope what we are going to talk about is going to be useful to you and is going to help you in your journey to health.
Amen.
Thank you. So last time we have spoken about what is bad in Western diet. And as we said, Western diet is called SAD in America, which is stand for Standard American Diet. So I think it is really sad because it can give a lot of people a lot of hard time. You see, when they get to the other end of it, giving them dysfunction, discomfort and disease as well. So I think it is sad, really. And we said what is bad about Western diet because it is energy dense. You have got too much calories with very little fiber and very little nutrients. So there is lack of nutrients and there is high level of toxins on it. and it is sterile because it's coming from a factory. So it hasn't got any live stuff like friendly bacteria on it. And I'll tell you the importance of this friendly bacteria is really very, very important. And it has gained a lot of importance now, recently. So what we are going to talk tonight, we are going to look into the negative effect of Western diet. And as I said, we are going to address the issue of the energy, high energy. And high energy is really the most terrible effect of it because lack of fiber, this will just go very, very fast through you and get into the blood and raise the blood sugar very high in few minutes. And that's the worst thing about it, because it is not the formula which we should really have. It's a different formula. And the lack of nutrients is another thing which is very important, because you need the nutrients at least to process this food. Because without nutrients, you are not going to be able to process the food and make it in the form of the energy that is going to help your body. And then the other things we are going to talk about, its external effect. Meaning the thing which you see outside. You see you are, or somebody is growing up in size, is putting too much weight. That we estimate this as BMI, which is the body mass index, or the waist-hip ratio. It's another way of expressing this excess body weight. And then we see it internally reflected into the blood sugar and the other parameters which we are going to talk about. And then we will see the other effect of it, as I said, the deficiencies, and the most important two things is magnesium and vitamin D. The allergy or sensitivity, I'm talking about food sensitivity associated with diet, and this is probably due to the recent or the latest really changes in the food itself. And the microbiome, which is a friendly bacteria, now it has gained a lot of importance, and I'm going to tell you about that as well. So this is the Western diet. This is the sad. This is sad. A lot of bread, a lot of pasta, a lot of fizzy drinks, alcohol. They're all are going to be converted into sugar. So the whole lot is going to be converted into sugar. And what is bad about sugar? I think I'm coming back to this bad and good. George Orwell, when he spoke about the good and bad in his Animal Farm book. And I think the bad thing about this, because we are taking too much sugar or too much carb while we have got no capacity at all to store them. I think this is the whole problem, because our capacity to store sugar, which is reflected in how much are we going, we usually store in terms of glycogen. Glycogen is sugar. So how much glycogen we store is not more than 2,000 calories. This is both in the liver and muscles. So if you are going to take more than that, then I think it's going to be converted into fat. It's not going to be converted into protein. It's going to be converted into fat. And that is the bad thing. Because if it stays as glycogen, as sugar, then as if it is in your kitchen fridge. So it is available for you anytime you'd like to take it or to use it, that is available for you. But when it is converted to fat, then it's going to go into your, in your basement freezer. And it's going to be very, very difficult to use it. It's not available for you. It's just like bonds. You're talking about cash, and you're talking about bonds here. This is not available for you. You have to struggle too much to get it ready to use it anytime. But there are two different things. If we are talking about the old time, when we have got fat, when we have a feast, because in the past, because we are hunter and gatherer, we have got the feast time and the famine time. And when we have a feast time, then we have got more energy, and then we store this energy into the body. But it goes somewhere else than the energy which comes from the Western diet, which is it's a different form of energy. It goes into the tummy, most likely, most of the time. But the energy that comes from the good carb, it is always stored in the subcutaneous tissue all around the body, and mainly in the hip area. That is healthy way of storing fat. But when it comes into the tummy, this is not a very healthy way of storing fat, and I will talk about that in a minute. This is one of the tools. BMI, body mass index, is one of the tools which we use to assess the health in general and the body fat content. And as we see, it is the body weight over the height square. And I don't think the height is going to change. Nobody is going to change his height easily. You see, that is going to be constant. So if the BMI is going to go up, then your body fat content is probably going to go up. So it's a good way to estimate the body fat. But also it can go up if your muscle mass goes up. So it's not a very good way of estimating the body fat, because in athletes, the big guys who play rugby, for example, they have got a high BMI, but they are probably healthy. So it doesn't really reflect that much about health. And this is why I thought it is of limited value. And these are the normal is around 18.5 to 24.99. Anything above 25 is going to be overweight, and anything above 30 is going to be 30 BMI is going to be obesity. And you have got 3 grades of obesity, grade 1 and grade 2, and then the morbid obesity when it goes up to 40 BMI. When the BMI go up to 40, and as we have seen in the previous talk, that is going to cut about 10, 12 years out of anybody's life. So nobody would like to be here. You would like to be most of the time here. But the problem here, if you, this actually standard has been taken on the Caucasian people. So if you are not Caucasian, then please do not work on this, because I myself, I'm not really going to work on this, because you see, the normal here is probably going to be obese for me. And look, this is the measurements which has been done on the Asian people. So the normal is going to be 18.5 to 22.9, and anything over 22.9, anything 23 and above is going to put them into the bad zones. They are going to be overweight, and they are going to be obese at 25. And 25 in the Caucasian one is just overweight. But they are going to be obese when they go to 25 in the Asian. And I think on the Afro-Caribbeans as well. But this study is done on the Asians. So I think it is lower for the Asians. And so don't really take it for granted. This is a better way of looking at your body fat. As you can see here, it's a very beautiful, what do you call it, pear. And there, a very ugly apple. That's a very, very good thing. and the good thing that the waist and the hip ratio, waist-hip ratio reflects, it reflects the amount of fat in your tummy. And that's what matters. That's what matters. You want the fat anywhere in your body, but not in your tummy. You see? And this which has been linked with the risk of disease. And that is the cause, the real cause of disease. And as we can see here, for men, I wouldn't really go up to that level. You see 37 inches, 40 inches associated with very substantial risk of disease. But the disease actually 37.5, you see, is risk of disease as well. So you want to be below that. You'd like to be below 35 if you can, or below 34. That would be a safe area. For women, I think they should really be at that area, 32 or 35. They should be below 35, and they should be below 32 as well. So that is going to be the appropriate place where they want to be. And if you take the ratio, the cutoff is 0.90 for men and 0.80 for women. So that's what you want to be. And why are we worried about the fat in the stomach or in the abdomen or in the around the viscera? This is actually waste adiposity. What? Waste adiposity. Why are we worried about fat in this area, in your tummy or around your viscera? Because it's an inflammatory. By itself, it's an inflammatory. It's not really like an inert fat sitting in your body for nothing. It is that is endocrine tissue. When it sits in your stomach, then it is an endocrine tissue, and it produces inflammatory markers. Interleukin-6, tumor necrosis factor, these are inflammatory factors. And these inflammatory factors will have a negative effect on your insulin. I'm not really talking about the acute inflammation. Don't take me wrong here. Acute inflammation is very useful to anybody. If you are injured, for example, or if you a cut in your hand or whatever, then it becomes red, and then it becomes warm, and you feel pain, and it becomes swollen. And I think probably Pastor Chris would probably tell us about the names. This has been discovered by a physician called Galen, a Greek physician, Galen. And then I think red, they call it rubor, heat, dollar, or something like that. Pain, dollar, I think, and swelling, tumor, something like that. These are the names which are being given to this. This is a good inflammation, because this, like say, you have got more circulation coming to that area, so the area is becoming red, and more inflammatory cells coming there to remove the debris and to clean the area and to initiate the process of healing. That is what you want here. What I'm talking about in terms of bad inflammation, it is the low-grade inflammation, which happen for purpose, for no purpose at all, and it continues for a long period of time. That's what you do not want to have, because this is the base of most of the chronic conditions, including obesity, diabetes, heart disease, asthma, IBS. They're all, this is the base of all the chronic diseases. So you don't want this one. And when the inflammation happens, it hits the insulin immediately and causes insulin resistance. So that's really the big problem that happens here. Because your insulin, you need the insulin, because the insulin is the key that opens the door of every cell in your body to get sugar getting inside them. And when sugar gets inside your cells, then it provides energy, And this energy help your cells to run all the very important function they run on daily basis. So you do not really want to lose this function. You see? If you can imagine, what is the receptor? Insulin sit on the receptor just like, you know, the oyster. The oyster, when you put the card on the oyster on the receptor, and then it open the gate for you to go in. Exactly the same thing. But what will happen here, when you have insulin resistance, then the door opens halfway. So for example, if you need something like 100 units of glucose inside your cells, and you have got, say, receptors along your cells, and say, for example, insulin come out, and then 10 of these gates were open. And each gate is going to allow 10 units of glucose inside. Then you will have your 100 units of glucose inside. But if the door is halfway open, then I think you have got 10, but you need another 10 insulin molecules to open another 10 gates, so as to get the same amount. And this is why your insulin is going to go up like that. Your insulin is going to go up like that, because you see, every time you see when you are more insulin resistant, then you have to pump, the pancreas has to pump more insulin to allow the exact amount of sugar you would like to have inside your cells. So you end up with a very, very high level of insulin, and that is not really a very good thing, as we are going to see in a minute. This is the high insulin. Because glucose is not allowed, so your glucose level will go up. Your blood pressure is going to go up because your vessels are become a little bit thicker. Your cholesterol, the good ones and the good ones are going to go down, the bad ones is going to go up, and your uric acid level is going to go up. And that's what happens in every person that have a high insulin level. So high insulin is not really a good thing. And this is why high insulin causes weight gain, because the cells are blocked for insulin. So what will happen there, the blood sugar is running around, you see, trying to find an open gate to get into your cells, but because there is insulin resistance, so the gates are closed, you see. So what will happen, the body will divert all this energy into the fat. They call it adipose tissue. And this energy is going to be deposited as fat in the body. It's going to go straight into the store. It's not going to get into your cells so that they are going to give you energy and vitality. No, it will go straight into the storage, and is going to show up as weight gain, and later on disease. And this is a very common thing here. When people become insulin resistant, particularly young ladies, you see, they become infertile, and this is because of the polycystic ovary syndrome. So because you see the fast dividing cells in the body divide very, very fast, you see, and then it can give cysts in the ovary, and young ladies becomes really infertile. In men, it can enlarge the prostate and can give hemorrhoids and varicose veins as well, for the same reason. This is just some of the summary of some of the research, and it just reflects that, you see, everybody knows that, you see, insulin causes weight gain, but in slim people, you see the secretion of insulin just go at a lower level, and it vanishes fast. So the difference between insulin secretion in a slim person or in a fat person is that the slim person, you see, they don't get too high They don't get a peak of insulin, and what they have got will just vanish very fast, disappear very fast. While the fat people, you see, they have a peak insulin that lasts longer in the system. And as we said, you see, by the time when people have a high insulin, then they set themselves for this serious path. Not all of them, they are going to become diabetic, but the majority of them, they are going to be insulin resistant. Some will become pre-diabetic, which is, they call it metabolic syndrome, and some will become diabetic. But I mean, if you can say, for example, how many percentage of people, my imagination, I don't think there is very accurate data to say what are the percentage of people who are in each group. But I think there are too many insulin-resistant people, and I probably say it is not less than probably 50% of the population, while the pre-diabetics might be about 25% of the population. And diabetes, previously it used to be about 7–8%, but now I think it has gone up probably to 10%. So these are probably just like approximation. But even the diabetic, you see, at the very serious part of the syndrome, half of them are not aware of the fact that they are diabetic. So leave alone these people at the beginning of the step. You see, I think most of them, they will not be aware about the fact that they are insulin resistant. It's very important here just to realize what is normal and what is abnormal. I think if somebody is insulin resistant only, and you check their blood sugar is going to come back as normal, completely normal. And that happened to me, myself, you see. I checked my blood sugar several times. It was absolutely normal, and I'm insulin resistant. And then one day I decided this cannot be right. And I went and I checked my insulin level, and it came 20. The normal is about 5 or 6. So it is 20. And that's what has encouraged me to play the game of reducing my insulin level. And when my insulin level came down to a reasonable level, a safe level, and I started to feel far much better. For those who are pre-diabetic, these are the fasting sugar will be between 6 to 6.9. Because you see, when they reach 7 fasting sugar, blood glucose, that is diabetic. That is diagnostic for diabetes. So, but the pre-diabetic is between 6 to 6.9. And there is another tool which we also do, apart from the blood sugar. It's called hemoglobin A1C. And hemoglobin A1C, it is the average glucose control over the last 3 months, because we are taking the red blood cells. The red blood cells usually last for 3 months. So when you take hemoglobin A1C, which is like, say, glycation, because you see, you have got too much sugar. When you have got too much sugar in blood, this will damage the proteins, and these RBCs are part of the thing that can get damaged with high blood sugar. But because they live 3 months, and you get your hemoglobin A1C, that will reflect the glycemic control over the last 3 months. So this is the level for the pre-diabetic, 5.7 to 6.4. For the diabetic, then you're talking about anything less than above 6.4 would be diabetic, and their fasting sugar should be above 7, and their random should be above 11. And there is another figure which you probably would like to know about, and it's a very, very important one, which is the blood sugar 2 hours after meal. They call it postprandial blood sugar. And that is a very, very good, very important one, and it shouldn't go above 7.8. There are quite a lot of changes now in the definition of diabetes and pre-diabetes. And I think recently the American Diabetic Society, they came up with something different. They take the fasting 1 hour, 2 hours, and 3 hours. They take the blood sugar, fasting blood sugar, 2 hours, 1 hour, 2 hours, 3 hours. And if somebody has got two abnormal of these levels, then this is diagnostic for diabetes. One of the things that can happen with the abnormal sugar is something called obstructive sleep apnea. Obstructive sleep apnea. That is a very, very common condition. People will always laugh about it, saying somebody is snoring next door or next room. And it happened to me actually when I came to this country, and I was in a room, and then there's somebody who came on the next door room and the next door, and both of them, they were snoring. And it was horrible. I couldn't really sleep for a few days until I asked somebody to take me somewhere else. But this is some people would laugh about, but this is a very, very serious condition. These people have got some sometimes they are obese, sometimes they are not, but they have got weakness in this upper respiratory way, and the tongue and the surrounding tissue will just fall back on the respiratory passage, and while they're sleeping, and they snore initially, and when there is complete blockage, they wake up, and then they go back to sleep. So they wake up several times a day, and they have night sweats. That's very important to ask them. You see, do you sweat at night? They say, yeah, yes, I sweat at night. And when they wake up next morning, they wake up with a headache, you see? And all the day long, they are very, very, very sleepy. So this is a very common condition associated with blood sugar abnormality, you see? And it's serious because 80% of them will become pre-diabetic, 25% of them will become diabetic, and 20% of them will have a stroke. And the most serious thing about it as well is, this is ghrelin, which is the hunger. We call it the hunger hormone. Actually, is released in high quantities, and that makes people very, very hungry, and they eat all the day long. And they go into a vicious cycle. It started by weight gain, and then more eating, and more weight gain, and they get obese and endless. Another thing serious about it is many of these patients, even before they develop diabetes, they run into troubles. And as we said, the most important, the commonest problem is high blood pressure. And I think, actually, when we teach, the medical students, we teach them most of the hypertension is essential hypertension. It's idiopathic. It does not have any cause, no reason for it. But when I moved into this area, I realized most of these patients, they are hypertensive because of the metabolic disease, because of this sugar issue, of this sugar problem. So the sugar problem has given them the high blood pressure. And it is the most common cause, actually now, of liver disease. Before, alcohol was the common cause of liver disease. And it's very serious because they can go from fatty liver into liver cirrhosis, and they can develop liver cancer as well. So that's really very, very serious. The other thing, dementia, Alzheimer's disease, now is called type 3 diabetes. It is type 3 diabetes because type 1 diabetes is when you lose the pancreas completely due to an autoimmune condition. And this usually happens in children. They have got no insulin. You have to inject them with insulin. Type 2 is because of this is the other type, and because of the overweight and things like that. But type 3 is when your brain cannot extract sugar from blood. You see? And in this case, you see, it ran short of energy, and this is why the brain cells dies, you see, and the brain shrink and give dementia. So I think if you are going to look after yourself at this level, you see, before you have got any of these problems, that is going to be worthwhile. Because you see, the problems actually is not one problem. Yeah, people actually, when they get into this trap, you see, they are getting from one problem into another problem, into a third problem. So the other thing is retinopathy. I have seen many patients, you see, who started to have their vision failing. And this is even before they have developed diabetes. This is only from the stage of having insulin resistance, you see? And that is serious as well. And I have seen so many patients, they present with neuropathy, loss of feelings, and they have got, sometimes you see motor neuropathy. They are not able to mount any sort of movement in any particular, probably, most of the time you see it is in the periphery, you see? And that is another thing which can happen even before diabetes happens. And this is the vascular thing. You've got insulin resistance and atherosclerosis. You have got the insulin, metabolic insulin resistance, and that comes down from inflammation, and then it will just go into the blood vessels, you see, and it put all the plaques in the into the blood vessels, giving people heart disease, coronary artery disease, stroke, hypertension, heart failure, and vascular insufficiency. Vascular insufficiency, when the circulation to the limbs, the legs normally, is become insufficient, and people run short of blood supply and go into gangrene, and then they have to have their limbs being amputated. I think that's the most serious thing, and it can happen even before diabetes, you see? So this is why I think nobody should really want to stay into this area. Okay, I mean, what we do actually, when somebody comes to the hospital, and I used to work in the hospital for 30 years, when somebody comes to the hospital and we measure their blood sugar, and their blood sugar is showing that, I mean, they are abnormal level, like pre-diabetic. The pre-diabetic, we don't do anything. We just say, we are going to put you on surveillance. Please go and come back in 6 months' time, and we are going to look at your blood results again. And if you become diabetic, then we are going to start you on the medications to treat that, you see. Actually, this is the best time, actually, to see them properly and to prevent the condition in the first place. But if somebody is diabetic, then we will start them straight into medication. And then we'll monitor their progress. And most of the time, you see, these people will need increase of the dose. Say, for example, you start, say, glycoside 60 milligrams. You go into 120 milligrams, then 120 milligrams twice daily. And you just increase the dose. And when you reach the top of one drug, then you start another one. Usually happens in about 3 years. They go from 1 to 2, from 2 to 3, and up. And usually by the time when they come in 10 years' time, then they have really finished all the options of increasing and everything, and they are going to require insulin being given in addition to their tablets. So I don't think this is going to be a winning thing, because we are not dealing with the problem. We are just dealing with the symptom. And the symptom is high blood sugar. And when you give tablets or you give insulin, this will lower the blood sugar a little bit, but it will go right up again, you see, when the drug or the treatment run off. And the disease will progress. You see, this will continue to have this failing vision. They will have strokes and heart disease as complication. They have kidney failure. That's very, very common in diabetic. And they have peripheral circulation failure as well. And this is just like a proof to what I'm talking about. These are a big study. More than 10,000 people contributed to this study, and they have been given a very tight blood sugar, blood pressure, and lipid control. They have been given really very, very good medication to control all these three important factors. And unfortunately, their mortality increased, and they're having more adverse cerebrovascular complications. So I think we're not winning at all here. That is not really helping the patient, despite all the effort to control their risk factors. Somebody might say, okay, let us just forget about that. I would like to take another shortcut. And this shortcut, just saying, you see, as you said, you see accumulation of fat in the abdomen, in the tummy, is not good. I'm going to go for liposuction, or I'm going to go for gastric bypass to stop this thing happening at all. But that is not really going to help, because you have got all the bad signs, the inflammatory markers, or the bad markers of the disease, including the high blood sugar, the high blood pressure, high cholesterol, high inflammatory markers, you see, and the tendency for clotting. This is not going to change with gastric bypass and liposuction. But the other group, they have got a lot of improvement just with simple diet, even without really losing weight. So this is actually give you an idea. The diet is very strong and is very important, you see, than any intervention happening anywhere else. Now, if the conventional interventions are not very helpful, we're just wanting to explore another area. And this area, if we are going to look down into the factors that influences the risk factors, like high blood pressure, like your BMI, like your blood pressure, your glucose, your lipid profile, and do something about them. That means if we are going to look at things at upstream level, you see? So this one has been really very successful because, I mean, we have got two things. We have got the genes at one area, at one side, and the environment at the other side. And the mixture, the marriage between the genes and the environment is the thing that is going to give us the outcome. And I think there is now, you see, we know you cannot really control, you are not going to change your genes, but you can change your genes' behavior. And what is the genes' behavior? The genes are either going to cause disease or to give health. And there are different genes that can give you any or the other. So if you are going to control the genes that give disease, if you are going to stop these genes, to calm them down or to stop them, you see, or to modify them and to stop them really being in action, you see, and do the other way around, then I think this is what is known as epigenetics, and it is something which has been known over the last 10 years. So what we are trying to do is trying to reinstate homeostasis. Just like to give you an idea about homeostasis, if somebody has taken a bigger amount of fluids, of water, what will happen? The body will just activate, I mean, the kidneys to get rid of this excess water. Why? Because the saturation of different molecules in the body and the body water itself has to be kept at a constant level. You see? So what we are trying to do here is sometimes, you see, things just go out of control because of lack of something. And if you are going to reinstate this missing element, then that is going to help the system to come back again into balance. Sometimes it happens because you have got something which is unwanted, like toxins. So you want this thing to get removed for the system to come back into balance. And as we said, because the Western diet is lacking a lot of nutrients, and I thought the very important two nutrients to talk about is magnesium, and the other one is going to be vitamin D. And why magnesium is very important? Because there is, I mean, the diet generally is deficient in magnesium because of the soil. Now, we have got a very poor soil. And the other thing, we have got a lot of stress. And stress is the commonest cause of magnesium deficiency. Magnesium is very important because it's an enzyme, it's a cofactor that activates around about 3 reactions in the body. And it is very important in things like metabolism, protein synthesis, and energy production. So if you haven't got enough magnesium, you're going to lose out, you see, regarding all this function. And it helps blood pressure, and it helps in any acute condition. Actually, in the 70s and 80s, any patient coming with any acute condition through the hospital door, before we take any history, before we do anything with them, we will just give them an intravenous dose, good dose of magnesium before even talk to them, you see. This practice is not really, has vanished now, but I think this is what we used to do in the 70s and 80s. And it's good actually for, if somebody is going to take magnesium in the evening, it's very good. It gives them really a very good comfortable sleep at night. And it's very good for the bowel function because so many people taking magnesium will make them, what do you call it, normal. They are able to open the bowels. And the best magnesium actually is magnesium citrate. Vitamin D is another story. In this country, actually, anybody should really take vitamin D, whether you have checked or not checked, because everybody is deficient of this vitamin. And this vitamin, actually, the interesting thing about it, it's made up of, it comes from fat. It comes from cholesterol. Cholesterol is converted into vitamin D, you see? But people talk about vitamin D as related to the sun. The sun just activates vitamin D. And you have to do some other activation in the liver and kidney. So these are very important. If somebody has got, say, for example, kidney failure, chronic kidney disease, those who are going in dialysis, they are routinely given a high dose of vitamin D because they are going to be deficient of it. Not deficient of it, but they are not able to activate it because it has to be activated in the kidney. And if the kidney is not functioning, then that's not going to happen. Again, if anybody with any form of liver disease, and I think when we are talking about metabolic syndrome, then we have got people who having fatty liver or even non-alcoholic fatty liver disease, and their liver is not going to function properly. And I think these patients have to have a good dose of vitamin D as well. When we talk about vitamin D, it's a very, very good immune modulator. It helps the immune system. It reduces cytokines. These are the inflammation in the system, in the body, and it modulates the lymphocytes. And this is why I think it is more beneficial. You see, we are going towards the winter now, and people will have the flu jab in October normally. And I think it's more beneficial than the flu jab because the flu jab is given on the assumption, because we don't know what is coming through the door, but they're just trying to predict what sort of bug is going to happen, influenza is going to happen this year. And then they make it and they inject it to people. But if you are going to give vitamin D, is going to help the immune system, make the immune system strong to face whatever is going to happen. The other thing which I have also noticed here, the levels in this country is not the right level. They say anything around about 50 is good, but I think the blood level should be above 125. I'm talking about these things, the deficiencies, the sensitivities, these are all can give inflammation. Yes, this all can give inflammation. And inflammation is going to make you insulin resistant, you see. And the commonest sensitivities we face is around the gluten and dairy. The one in bread and pasta, these are the things which is contain gluten and the milk and dairy products. These are the commonest two sensitivities. So I think anybody would like to go through this life-transforming health intervention. I think it would be better if they could really stop taking these two things. I concentrate on these two things, gluten and milk and dairy products, at least for 4 weeks. And then you can re-challenge yourself. And if you are okay, then you can just carry on doing them again. But if not, then I think you can stop them for forever. But it is better to make sure that, I mean, the pasta and the bread and the white rice and these things, you see, they are very, very high glycemic index, and it's going to wreck your insulin, and it's going to cause problems. Tobacco smoking, smoking generally is a commonest cause of insulin resistance. I didn't realize this fact until I've just seen quite a few patients, you see, and then what is this? This is going here into the lung. It's not going into the, but because it causes inflammation, and it's a very, very common. It causes insulin resistance. These are the things at home, which can also the household cleaning agents, beauty, preservatives. Plastic is very important. These are all can cause insulin resistance. Very important thing here, the microbiome. And the microbiome is something new. And I think everybody should really know about that, you see. Now people started now talking about a transplant. Transplant, fecal transplant, it's not really a liver or a kidney transplant. Fecal transplant is going to be a standard treatment very, very soon for so many diseases. Because that's what is we are lacking. We are lacking the good microbiome. I mean, when I just think back, you see, about what we used to do in Africa, we don't really take that much food, but we have got really very, very good bacteria because there's quite a lot of bacteria around. And these bacteria help us quite a lot because, you see, they help you to manufacture, to synthesize food, items of essential nutrients which are not really available in your food. And it can work like, say, a detoxifier. It helps you with detoxification. And so I think this is going to be one of the things which you are going to see more about soon. And these are probably the essential supplements that can help your journey. So what we are saying today is that the Western diet, as we said last time, you see, damage your health. And the damage shows internally and externally, as we have discussed that. Addressing the risk factors, you see, at low stream level is not going to be helpful, as we have seen. We have to go upstreams and to look at to dig deep, I mean, for the causes that has brought the problem in the first place. We often need to take out things like toxins, infections, allergens, stress, or toxic relationship, and put in good things like nutrients, friendly bacteria, sunshine, fresh air, movement, sleep, nourishing relationship, purpose, and love. Thank you.
Thank you, Dr. Sharif. Again, very enlightening. Some of the things that we have to be reminded of constantly. I mean, you just get challenged because, you know, you think you're doing fine, but this is for life. It's not just for a moment. And to gauge what you're eating and what is happening to you when you eat it. You know, I've been challenged a lot. I mean, I do take vitamin D supplement, the one that you recommended, and magnesium. I mean, I've seen great progress. You know, I'm not the type of person who just wants it to happen immediately. I realize that this is a process that, you know, it takes you 30 years to get where you are, and then you want to, in 3 days, you want it to. But it does come back quickly. Your energy levels, you know, you look at your skin, you look at the shape of your body, it all happens quite quickly. But then you get the real benefits over time. And that's the wonderful thing, is that you start pushing everything in the right direction, and your body age and your biological age can be substantially bettered and increased in the right direction. So, you know, I know we have control over that. So we all want to be young, amen? This is the way to do it. And, you know, when you run a church and, you know, you do lots of things and you take on lots of responsibilities, you have to have the energy. And the last thing you want is you run out of energy and you can't do it. Well, here is an opportunity. You get your lifestyle right, you eat properly, you exercise, your energy levels come back, and of course you can do more. And you feel younger, look younger, and become younger. So it is about wellness, it's health, and of course it's being able to accomplish, you know, what I spoke about today is, you know, we all have a destiny. It's you know, if you look at the Word of God, you see that your destiny is predestined. It's you know, there's predestination. There is a destination, but then it's been pre-planned and ordained. And the only way to achieve that is to stay the course. So we're going to stay the course. And, you know, we always say that Dr. Sharif is God sent because, you know, in his quiet, unassuming, humble way, he's actually been such a blessing to so many people. And it's that information that we need. So thank you, Dr. Sharif. It's a great honor. And thank you all for watching. We look forward to the next session. And good night.